Are you tired of waking up with that nagging lower back or waist pain? What if I told you that in just 10 minutes a day, you could relieve stiffness, reduce pain, and improve your mobility, all from the comfort of your home? Before we dive in, hit that subscribe button and turn on notifications, because today I'm sharing simple, proven stretches and exercises that anyone can do, no equipment needed, and by the end of this video, you'll feel the difference. Understanding the pain and why stretching helps. Lower back and waist pain is one of the most common issues people face, especially if you sit for long hours, sleep awkwardly, or don't move enough. Your lower back supports your entire body, absorbs shock, and allows you to bend, twist, and lift. When this area gets tight or weak, you feel stiffness, soreness, or sharp pain that can affect your daily life. There are many reasons for lower back pain. Poor posture. Sitting for hours slouched forward puts pressure on your spine. Weak core muscles. Your abs and lower back work together to support your spine. Weak muscles can lead to imbalance and pain. Muscle tightness. Tight hamstrings, hip flexors, and glutes pull on your pelvis and spine. Sudden injury. Lifting incorrectly or twisting suddenly can strain muscles. Chronic conditions. Sometimes conditions like disc problems or arthritis can worsen pain. The good news? Most lower back pain can be significantly improved with gentle stretches and home exercises that restore mobility, strengthen muscles, and reduce tension. Unlike medications, these exercises target the root cause instead of just masking pain. Always listen to your body. Stretch slowly, breathe deeply, and stop if you feel sharp or radiating pain. Consistency is key. Doing a little every day beats intense workouts once in a while. Essential stretches to release tightness. Let's start with stretches. These are simple, safe movements that loosen tight muscles around your waist, hips, and lower back. 1. Cat-cow stretch, spinal mobility. Get on your hands and knees, shoulders over wrists, hips over knees. Inhale, arch your back, lifting your tailbone and chest up, cow. Exhale, round your spine, tuck in your chin and pelvis, cat. Repeat 10 to 12 times, moving slowly with your breath. Why it works. This stretch mobilizes your spine, relieves tension in your back muscles, and improves flexibility. 2. Child's pose, lower back relief. Kneel on the floor, big toes together, knees apart. Sit back on your heels, stretch arms forward, forehead to the floor. Hold for 30 to 60 seconds, breathing deeply. Why it works. Stretches the lower back, hips, and spine gently. Excellent for relaxation and pain relief. 3. Seated spinal twist, waist and back stretch. Sit on the floor with legs extended. Cross your right leg over your left, placing your right foot on the outside of your left knee. Place your right hand behind you, left elbow outside your right knee, and twist gently. Hold 20 to 30 seconds per side. Why it works. Opens up your spine, stretches your obliques, and eases tightness in the lower back. 4. Knee to chest stretch. Lie on your back, knees bent, feet flat. Bring one knee to your chest, keeping the other foot on the floor. Hold 20 to 30 seconds, then switch. For extra release, bring both knees to chest simultaneously. Why it works. Releases tension in the lumbar spine and relaxes tight glutes and hips. 5. Hamstring stretch. Lie on your back, one leg extended on the floor. Lift the other leg straight up, hold your thigh or calf, gently pulling toward you. Hold 20 to 30 seconds, switch sides. Why it works. Tight hamstrings often pull on your pelvis and worsen lower back pain. This stretch lengthens them and relieves strain. These stretches form the foundation for daily pain relief. They are gentle, effective, and require no equipment. But stretching alone is not enough. You also need strengthening exercises to support your spine. Now that we've loosened up your muscles with stretches, it's time to move on to strengthening exercises. Stretching helps your muscles relax and improves flexibility. But if your muscles are weak, especially your core, glutes, and lower back, your spine still won't get the support it needs. Strengthening these muscles is crucial, not just for relieving pain today, but for preventing it in the future. When these muscles are strong and balanced, your back stays aligned, your waist feels supported, and everyday movements become much easier and less painful. Let's start with a very simple but powerful exercise called pelvic tilts. Lie on your back with your knees bent and feet flat on the floor. Place your hands gently on your lower abdomen so you can feel your core muscles engage. As you inhale deeply, get ready to gently flatten your lower back against the floor by tightening your ABS and squeezing your glutes. Hold this position for about 5 seconds, then slowly release as you exhale. Repeat this 10 to 15 times. You might not feel like you're doing much at first, but this small movement activates the deep core muscles that support your spine. Over time, these muscles help reduce pressure on your lower back and prevent pain from coming back. Next, let's move on to glute bridges, which target your glutes, hamstrings, and lower back simultaneously. Lie on your back with your knees bent, feet hip-width apart, and arms relaxed by your sides. Press your heels firmly into the floor and lift your hips toward the ceiling, creating a straight line from your shoulders to your knees. At the top, squeeze your glutes tightly and hold for 2 to 3 seconds before lowering slowly. Repeat 12 to 15 times. Glute strength is often overlooked, but weak glutes are a major reason for lower back strain. When your glutes are strong, they stabilize your pelvis, help your spine stay aligned, and take pressure off your lower back during activities like walking, climbing stairs, or lifting objects. After glute bridges, let's do the bird dog exercise, which improves both balance and spinal stability. Start on your hands and knees, making sure your shoulders are aligned over your wrists and your hips over your knees. Slowly extend your right arm forward while simultaneously extending your left leg backward. Keep your spine neutral, avoiding sagging or arching excessively. Hold for 3 to 5 seconds, then return to the starting position and switch sides. Repeat 10 times per side. This exercise may seem small, but it is incredibly effective for strengthening the core and lower back, while also improving coordination and stability, which are key for preventing injuries in everyday life. Now, let us focus on the sides of your waist and your hip muscles with side-lying leg lifts. Lie on one side with your legs straight, head resting comfortably on your arm. Lift your top leg slowly toward the ceiling, hold for 2 to 3 seconds, and then lower it with control. Repeat 12 to 15 times on one side, then switch. Side-lying leg lifts strengthen your obliques and hip abductors, which are essential for supporting your waist and pelvis. When these muscles are strong, movements like bending, twisting, or walking become easier, and your lower back feels less strain. Finally, we have the Superman exercise, which targets your lower back, glutes, and shoulders. Lie face down on the floor with your arms extended in front of you. Gently lift your arms, chest, and legs a few inches off the floor at the same time, keeping your neck in a neutral position. Hold this for 2 to 3 seconds, then lower slowly. Repeat 10 to 12 times. The Superman exercise strengthens your posterior chain, the muscles along the back of your body counteracting the effects of slouching and prolonged sitting. Strong posterior muscles help improve posture, reduce fatigue, and protect your spine from injury. As you perform these exercises, keep a few tips in mind. Move slowly and deliberately, focusing on form rather than speed. Pay attention to your breathing, exhale during exertion or contraction, and inhale while relaxing. And remember, consistency matters more than intensity. Doing these exercises 3 to 4 times a week is much more effective than doing them sporadically or all at once in a single session. In addition to exercises, some simple everyday habits can help reduce strain on your lower back. If you sit for long hours, make sure to sit upright with your shoulders relaxed and feet flat on the floor. Take a short break every 30 to 40 minutes to stand up, walk around, or do a quick stretch. When lifting objects, always bend your knees and keep your back straight, lifting with your legs rather than your lower back. At night, a pillow under your knees while lying on your back, or between your knees if lying on your side, can relieve pressure on your spine. Applying a warm compress to your lower back before stretching or exercising can also help relax tight muscles and reduce stiffness. One thing many people overlook is the connection between stress and lower back pain. Stress causes your muscles to tighten unconsciously, particularly in the back and shoulders. Practicing deep breathing, meditation, or even light yoga for a few minutes a day can release this tension, making your stretches and exercises even more effective. By now, you've learned stretches to release tight muscles and exercises to strengthen your core, glutes, and lower back. But to truly relieve lower back and waist pain and prevent it from coming back, It's not just about exercises, it's about integrating them into your daily routine and combining them with small, smart lifestyle habits. The good news is you don't need hours at the gym or expensive equipment. With just 10 minutes a day and a few simple adjustments, you can see real improvements in your mobility, comfort, and overall well-being. Let's start by creating a simple, daily routine that combines both stretching and strengthening. Begin with a warm-up for 1 to 2 minutes. This could be gentle marching in place, rolling your shoulders slowly, or lightly swinging your arms. The goal is just to get your blood flowing and wake up your muscles, making them ready for the movements ahead. Next, move into stretches for about 4 minutes. Start with the cat-cow stretch, performing 10 to 12 slow, controlled reps. Focus on your breathing, feeling the spine move and loosen with each motion. Then move into child's pose and hold for 30 to 60 seconds. Let your body sink into the stretch and notice how your lower back and hips feel more relaxed. Follow that with the knee to chest stretch, holding each side for 20 to 30 seconds. Finally, include the seated spinal twist for 20 to 30 seconds per side, feeling the gentle rotation through your waist and spine. By the end of this 4-minute stretch segment, your lower back and waist muscles should feel looser, more flexible, and ready to work. After stretching, spend about 4 minutes on strengthening exercises. Begin with pelvic tilts for 12 controlled reps, focusing on engaging your deep core muscles. Move on to glute bridges for 12 reps, squeezing your glutes at the top of each lift. Next, do the bird dog exercise, extending opposite arm and leg and holding for 3 to 5 seconds, 10 times per side. Then perform side-lying leg lifts for 12 reps on each side, feeling the engagement along your obliques and hips. Finish with the Superman exercise for 10 to 12 reps, lifting your arms, chest, and legs together and holding for a few seconds at the top. Finally, spend about 1 minute cooling down. Lie on your back with knees bent, arms relaxed by your sides, and focus on deep breathing. Close your eyes, let your body relax, and notice the difference between how your lower back felt before and after the routine. This cool down helps your muscles relax fully and reduces post-exercise stiffness. While doing this routine, here are some additional tips to maximize results. Move slowly and with control. Fast or jerky movements can strain muscles and cause discomfort. Focus on quality over quantity. A few perfect reps are far better than many sloppy ones. Remember to breathe deeply and consistently throughout each exercise. Exhale during exertion, inhale while relaxing. Consistency is key. Doing this routine 3 to 4 times per week is much more effective than sporadic, intense sessions. Beyond the exercises, your daily habits can make a huge difference. If you sit for long hours, make a conscious effort to sit upright with shoulders relaxed and feet flat on the floor. Avoid slouching, leaning forward, or hunching over devices. Take a short walk or stretch every 30 to 40 minutes to keep blood flowing and muscles loose. When lifting objects, always bend your knees, keep your back straight, and lift with your legs instead of your lower back. Even small tasks like bending to tie your shoes or picking up groceries can benefit from engaging your core muscles. Your sleep position also impacts lower back health. If you sleep on your back, place a pillow under your knees to reduce lumbar strain. If you sleep on your side, a pillow between your knees keeps your hips and pelvis aligned, reducing pressure on your lower back. You can also use a warm compress on your lower back before bed to relax muscles and prepare for a good night's sleep. Hydration plays an important role too. Drinking enough water helps your spinal discs stay healthy, reduces inflammation, and supports overall muscle function. Nutrition matters as well. Foods rich in anti-inflammatory properties, like leafy greens, berries, nuts, and fatty fish, can support your back health and reduce discomfort over time. Maintaining a healthy weight also reduces stress on your lower back, making all your movements more comfortable and safer. Stress management is another crucial aspect. Stress can cause your muscles to tighten unconsciously, particularly in your back and shoulders. Incorporating deep breathing exercises, meditation, or light yoga into your day can relieve this tension. Even spending just 5 minutes taking slow, deep breaths while focusing on relaxing your back muscles can make a noticeable difference in how your back feels. For long-term support, consider integrating micro movements and posture checks throughout your day. Stand up and stretch during work breaks. Engage your core while walking or climbing stairs. And be mindful of your posture when standing, sitting, or lifting. These small adjustments might feel minor at first, but over weeks and months, they dramatically reduce the likelihood of chronic pain. By combining these stretches, strengthening exercises, and lifestyle habits, you're creating a complete system of back and waist care. You're not just treating pain temporarily, you're building a strong, flexible, and supported foundation for your spine. When your muscles work together correctly, your lower back and waist can handle daily activities more efficiently. You move with less discomfort, and your overall quality of life improves. Now that you have this full routine and lifestyle guidance, it's time to take action. Start with 10 minutes a day, stay consistent, and gradually increase the intensity or hold times as your muscles get stronger. Remember, the key is small, consistent steps rather than pushing too hard too fast. Over time, you'll notice less stiffness, reduced pain, improved mobility, and more confidence in your daily movements.